WPLG 715, Fireman Kenny's on the air, helping you to stay safe in a world where danger never takes a vacation. On this episode of the Fireman Kenny Show podcast, we interview Ginger Knapp, Kelli Anderson, and Kim Lombard about National Trauma Awareness Month. Welcome back to all 13 of our listeners to another installment of the Fireman Kenny Show podcast. The American Trauma Society and the Society of Trauma Nurses has declared May as National Trauma Awareness Month. On this episode, we interview Froedtert and the Medical College of Wisconsin Trauma Program Manager Ginger Knapp, a friend of the show, Ascension St. Joseph's Hospital Trauma Program Coordinator Kelli Anderson, and Froedtert and the Medical College of Wisconsin Injury Prevention and Outreach Coordinator Kim Lombard about trauma and injury prevention strategies. Before we begin the podcast, we would like to mention our sponsors. For over a century, the National Fire Sprinkler Association has been advocating for a stronger industry and a safer world by promoting fire sprinklers in model codes and legislation. Their mission is simple: to protect lives and property from fire through the widespread acceptance of the fire sprinkler concept. Be sure to follow the National Fire Sprinkler Association on Facebook, Twitter, and LinkedIn. You can visit the National Fire Sprinkler Association website, www.nfsa.org. We would also like to thank our friends at Fire Suppression Solutions, distributor of fire suppression products for the fire service and for home use. You can follow Fire Suppression Solutions on Facebook, Twitter, LinkedIn, and YouTube. Now a word from Fire Suppression Solutions.
Fire can strike without warning, leaving you with precious little time to react. And if you are not prepared, the damage can be devastating to life and property. In the blink of an eye, your home or business could be on fire, with flames doubling in size every 30 seconds, leaving you helpless and unable to respond. Don't let this nightmare become a reality. That starts with being prepared. Our fire suppression products are designed to equip you with an effective response to any fire emergency, all while limiting additional damage, making you the true first responder, giving you the peace of mind that you have what you need to keep your loved ones and property safe until more help comes. Do you have a plan to respond to a fire emergency at your home or business? Protect your family, pets, and property with the tools from Fire Suppression Solutions. Contact us today and finish putting your plan into effect before it's too late.
For more information on Fire Suppression Solutions products, you can visit firess.us. Welcome back to all 13 of our listeners to another installment of the Fireman Kenny Show podcast. Trauma is the number one cause of death for people under the age of 45. The American Trauma Society and the Society of Trauma Nurses have declared May as National Trauma Awareness Month. Today we are talking with Ginger Knapp, Kelli Anderson, and Kim Lombard about trauma and injury prevention. Everybody, welcome to the show.
Good morning. My name is Ginger Knapp. I'm the Trauma Program Manager at Froedtert Hospital, an adult Level 1 trauma center. I also serve as the Treasurer of the Southeast Regional Trauma Advisory Council.
Hello, my name is Kelli Anderson. I am the Trauma Program Coordinator for Ascension St. Joseph's Hospital and current CERTAC Chair.
Hi, I'm Kim Lombard. I'm the Injury Prevention and Outreach Coordinator for Froedtert Hospital. We are an adult Level 1 trauma center based out of Milwaukee, Wisconsin.
In 1988, May was declared Trauma Awareness Month to dedicate time and resources to trauma awareness, education, and prevention. Injuries can result from falls, car crashes, weapons, and recreational vehicles, to name a few. Every year, the American Trauma Society teams up with the Society of Trauma Nurses to develop a theme and marketing campaign to spread education and awareness for trauma and, most importantly, trauma prevention. So, Ginger, why don't you tell us about the theme?
Sure, Kenny. Thanks again for having us on. This year's theme is Model Safety Every Day for a Stronger Tomorrow. National Trauma Awareness Month 2025 emphasizes that injury prevention starts with each of us, making safe choices daily, whether on the road, at home, or in the workplace. We create lasting habits that protect ourselves and influence those around us. Small actions like wearing a seatbelt, using protective gear, or eliminating distractions can inspire others and build a culture of safety. Together, we can create a safer, healthier future for our communities.
So a lot of our listeners may not actually understand the definition of trauma. Kelly, why don't you tell us what trauma actually is?
Today we're here talking about physical trauma. This would be any unplanned mechanism or force on the body that causes injury. Some examples include motor vehicle crashes, falls, gunshot wounds, assaults. Injuries are the leading cause of death for people between the ages of 1 and 44 years old. According to the National Safety Council, in 2022, there were 227,039 injury-related deaths in the United States. All were preventable. There has been an increase of 162% of preventable injuries-related deaths over the last 30 years, making the need to bring awareness and prevention to the forefront. According to the National Safety Council and CDC in 2022, the top 3 leading causes of preventable death in ranking order were poisoning, falls, and motor vehicle crashes. The top 3 leading causes of non-fatal preventable injuries treated in emergency departments in ranking order from 1 to 3 were falls, being struck by an object, and motor vehicle crashes.
One of the things we can talk about is how motor vehicle crashes contribute to traumatic injuries. Let's talk about the dangers involved with motor vehicle crashes.
So in the United States, we know everybody gets around with their car, right? So that's like our main means of transportation in the United States. I know I need my car. I'm very reliant on having a car. And the mobility I get from having a car is really important to me. But with that being said, we know that traffic crashes took the lives of more than 42,000 people in 2022. According to the U.S. Department of Transportation, the National Highway Traffic Safety Administration, 1 person was killed every 12 minutes and an estimated 5 people were injured every 5 minutes in traffic crashes in 2022. Also in 2022, there were more than 12,000 fatalities related to speeding. So we know that obeying the speed limit is an important thing. Moving into alcohol and drugs and the impact they have on motor vehicle crashes, in 2022, there were more than 13,000 alcohol-impaired driving fatalities. 67% were in traffic crashes in which at least one driver had a BAC of 0.15 or higher. So we're going to talk more about this, but we know it's important not to drink alcohol and drive. But really, we also need to consider other things that you might be taking that could just impair your focus. So oftentimes you see warnings on even over-the-counter medications, things like that, that people don't realize can actually impact their driving and can actually cause an impaired driving crash. Moving into seatbelts, 50% of the fatalities in 2022, a restraint was not used, which is actually kind of astronomical to me to think that people don't wear their seatbelts. I know my car alarms and beeps at me if I don't wear a seatbelt. That would be very annoying, I would think, to people. But what we know is that in 50% of those crashes in 2022, people were not wearing a seatbelt. And another important factor, we talk about distracted driving and we talk a lot about teenage distracted driving. So we know that 4,000 teens are lost each year in preventable crashes. So if we look at even today, so today, Monday, we will lose 11 teens in a preventable driving crash. So 75% of these teen fatality crashes did not involve alcohol or drugs. I want to just kind of reemphasize that. So we know 4,000 teens are lost each year in a preventable crash, and 75% of those did not involve alcohol or drugs. You know, you kind of have to ask yourself, like, what is a contributing factor to this? And what we know is distraction. Distraction can come in a lot of forms, and we know that teens are not the only people vulnerable to distraction. We know that we're all really busy people, but teens are sort of particularly I don't know if I want to say involved or prone to some distraction.
Thanks for all that information, Ginger. Since you and I, as well as Ashley and Bria from Children's Wisconsin, conducted the What Do You Consider Lethal training from Impact Teen Drivers, there are a number of the distractions that are listed in that program. So, Kim, why don't you tell us about those types of distractions that cause crashes for teens and adult drivers?
Thanks, Kenny. There's actually 4 different types of distraction. There is a manual distraction, visual, cognitive, and auditory. For manual distraction, that's when we're taking one or more hands off of the wheel. So if we're fixing our hair or looking at our phone, that does provide us an opportunity to lose control. And in a scenario where we're driving through traffic, we need to be able to react quickly. If we only have one hand on the wheel, that might reduce our reaction time. There's also the visual distraction. So that's when we're taking our eyes off of the road. So perhaps looking down, if we drop something, going to reach it, again, looking in mirrors. We do want to avoid any opportunity to look anywhere else other than the road in front of us or in our mirrors for driving. There's also that cognitive distraction. So if we're feeling emotional, if we're angry, we're tired, we're really not focusing on the road, which can cause crashes. So being cognitively focused on the task that we're doing is very important. And then there's that last distraction, which is auditory. So if we're not able to hear the traffic around us, if we're not paying attention, for example, if we have earbuds in or our music might be up too high, that would be an opportunity for a potential risk factor. So if we want to try to avoid these things, I know it can be difficult to really focus all the time, all at once, but we really need to do a job of not trying to multitask while driving. So, focusing on adjusting our mirrors prior to getting behind the wheel, selecting our music beforehand, eating our food outside of the car or making phone calls. Those things should really take place outside of the vehicle. There's also some apps that can help us to avoid using our cell phone while driving, so go ahead and look. Feel free to look to see what's out there at your app and Play stores. So we can try to reduce these distractions even if we're a passenger riding in a car, so we can assist our driver by assisting with navigation, keeping the noise down, and just being respectful passengers in the vehicle. We can also speak up. So if you notice that the driver of the car is driving distracted, we should speak up at that time and remind them that focusing on the road and focusing on each other's safety is a priority. To remove distractions, it really is all about choices. So on any given day, we have choices, what to wear, what do we eat for breakfast. Many times our behaviors are contributing to our distractions while driving. So keep in mind choosing not to text and drive. You can also choose not to talk on the phone while driving because even talking is a cognitive distraction. Wait to do your makeup. If you are upset or angry, take that time to calm down before driving. And of course, we want to wait to yell at our kids until we get home.
So another issue we have with traumatic injuries is falls. Kelly, why don't you talk about falls as well as the CERTAC Falls Prevention Program?
Thank you, Kenny. So in 2023, over 23,000 individuals were injured after a fall. Falls occur for different reasons in different age groups. One large group that we've really chosen to focus on is the falls that occur in 65 and older. 1 in 4 people 65 and older fall each year. Wisconsin has the most fatal falls nationwide in that age group. The age group often suffers more severe injuries due to age-related changes within their body, making them more susceptible to severe injuries. For example, bone demineralization, osteoporosis sometimes makes fractures more common. Fall prevention is key. Stopping elderly accidents, deaths, and injuries, better known as the STEADY initiative through the CDC, recommends that healthcare providers screen and assess older adults for fall risk and intervene using effective prevention measures. Some of the things that you can do in your own home is to make it safer. Essentially, to stay independent, which is a program also supported by the CDC, has some recommendations. Speak up. Talk openly with your healthcare provider about fall risk and prevention. Ask your doctor or pharmacist to review your medications. Talk to your doctor about medications as some might make you feel dizzy or sleepy. Keep moving. Begin an exercise program to improve your leg strength and balance. Balance and strength exercises are key. As easy as 15 minutes of simple exercises can really go a long way in helping you to keep moving. Obtain an annual eye exam, replace your eyeglasses as needed, and make sure that you're wearing them. And number 4 is to make your home safer. Remove clutter, tripping hazards, remove loose rugs or cords that are over walkways. Try to reduce large amounts of clutter near those walkways. Ensure proper lighting whenever possible. Sturdy and functional handrails are often helpful. To learn more, as Kenny said, SERTAC does offer injury prevention kits and resources for fall prevention. These are available through area emergency departments and hospitals as well as primary care providers. Also, contacting your local or community senior centers often have more information about exercises, fall prevention programs, and additional options for improving home safety. The cdc.gov/falls has a wealth of information in fall prevention.
That was some great information on falls, Kelly. So Kim, Froedtert and the Medical College of Wisconsin offers the Stepping On program. Why don't you tell us more about the facets of that program?
Sure, Kenny. Stepping On is an evidence-based fall prevention program specifically designed for people that are living independently in the community and who are age 60 and older. Stepping On is an 8-week program where community members join with other peers. It's a small group program where we're coming together and learning a lot about fall prevention within those 8-week sessions. It is led by 2 trained facilitators, and within the program we also bring in various guest experts like a physical therapist, a pharmacist, a vision expert, and a community safety expert to really provide some education and information about fall prevention. Many times people are coming to the program because they are fearful of falling or they actually have had a fall and are really looking for ways to prevent those falls. Because Stepping On is evidence-based, we really have an opportunity to change behavior. So throughout the workshop, people are learning how their fall may have occurred and perhaps thinking about things that they can do to change that fall in the future. So much of the program is based off of behavior change theories where people are actually making changes, picking up those throw rugs off of their home, becoming stronger, practicing exercises, and ultimately increasing their confidence to reduce falls, but also, more importantly, reducing the chance of them falling.
So Kim, how can people find information on the Stepping On program?
Yeah, if people are interested in taking this program, we do offer this program through Froedtert about 4 times a year. There's in-person opportunities as well as virtual. You would want to go to froedtert.com/classes for links and to search for when those workshops are occurring. You can also reach out to us directly at the Trauma Center at Froedtert Trauma Center at froedtert.com is our email.
Since this show focuses on community risk reduction, and we know that May is just loaded with community risk reduction awareness campaigns, we could do one every day without repeating them throughout the month of May. But one of the other campaigns related to Trauma Awareness Month is Stop the Bleed Month. So Kim, why don't you tell us about Stop the Bleed and Stop the Bleed Month?
Sure. So bleeding incidents can occur anytime to anyone, whether from a car crash, falling from a roof while cleaning those gutters, a serious cut at home, or injuries stemming from violence. These injuries can even occur at our workplace, public places, our home, really anywhere. That's why it's really important to be able to react quickly if you do see somebody who's bleeding badly. Knowing what to do lets you take control of that situation and help save a life, no matter where that injury happens. Knowing how to recognize and control severe bleeding is important and can save a life. So what is Stop the Bleed? Stop the Bleed is a worldwide program created by the U.S. Department of Defense. Their program is based on lessons learned from wars in Iraq and Afghanistan about how to best control severe bleeding. Here at Froedtert, we utilize the American College of Surgeons curriculum was created after 2012 when 20 children, 8 adults were casualties from a mass shooting at Sandy Hook Elementary School. So with that, Stop the Bleed was created and established as a national awareness campaign. In 2015, the White House sent a call to action to begin training people to become immediate responders while waiting for professional help to arrive.
So, Kim, a lot of our listeners may not have taken a Stop the Bleed course or may not even know what it is. So, if they are interested in taking a Stop the Bleed course, what kind of things can they expect while involved in the course?
Thanks, Kenny. So I just want to start by saying that bystander intervention is really crucial in saving lives. So lots of times people just don't know what to do in these situations. If somebody's bleeding severely, people tend to panic, right? They don't know what to do. So what Stop the Bleed does is it teaches people the appropriate steps to take when they're faced with a bleeding emergency. On average, it can take about 7 to 10 minutes for first responders to arrive on the scene. This can vary depending on location and traffic conditions, and blood loss can occur very quickly when somebody's experiencing a severe bleed. We're talking minutes. The average time to bleed out after severe injury is 3 to 5 minutes. So teaching people how to react within that first 60 seconds by applying pressure, packing a wound, or using a tourniquet can be the difference between life and death. And this is what Stop the Bleed provides. It really provides a program to train up the community as well as equip the community with what to do when traumatic injuries involving severe bleeding happen. So while people are waiting for first responders to arrive, there's steps that you should take, and that's what you're going to learn in this Stop the Bleed program. So in the program, we're learning how to recognize what is life-threatening bleeding, what does that look like, what are the steps to check for that scene safety, making sure that you keep yourself safe, and then when and how to call for help. We are then doing hands-on application where people are learning how to apply pressure, how to pack a wound, and how to secure a tourniquet to control bleeding. This is an hour-long course. Most times it is free in most communities. And then participants also have the opportunity to do that hands-on practice during that hour-long course. It might sound very intimidating to save a life and to have to react, but really anybody can do this with the right tools and training. You don't need any medical experience, and it's good knowledge to know if this ever were to happen to you.
For Stop the Bleed training, there are multiple resources that are available. The American College of Surgeons does have multiple resources available online. However, SERTAC does offer Stop the Bleed training as well as resources for those interested. That's at sertacwi.com.
So we've mentioned SERTAC and the involvement that all of you have with the organization. Why don't you tell us more about what SERTAC is and what it is that it actually does?
So SERTAC is a regional RTAC committee, which is a regional trauma advisory council comprised of healthcare organizations, first responder agencies, public safety, and public health partners collaborating to develop, implement, monitor, and improve their regional trauma system. Wisconsin has established 7 RTACs that align with the 7 Healthcare Emergency Readiness Coalitions, better known as HERC. In order to serve their purpose, RTACs are charged with doing all of the following: establish an executive council that reflects professional representation from out-of-hospital providers, trauma care facilities, education, and injury prevention. We also analyze local and regional trauma registry data, creating a local and regional performance improvement process, developing and implementing injury prevention and education strategies based on performance improvement findings, developing and submitting to the Department of Health Services, or DHS, as a regional trauma plan based on a needs assessment, and developing regional triage and transport protocols.
So, Ginger, a lot of our listeners may not be aware of the different levels of hospitals, and they are different levels of trauma centers. And Froedtert and the Medical College of Wisconsin is listed as a level 1 trauma center. Why don't you tell our listeners what a trauma center actually is?
Sure thing, Kenny. So the very basic nature of becoming a trauma center, it means that a hospital has completed a verification process based on set criteria, okay? So the criteria that we use is a set of standards that the hospital must meet to ensure that they have the capability to care for injured patients. And some of the examples of what's included in these standards are, the access to equipment, personnel, education, and quality review. And in Wisconsin, the state of Wisconsin, so every state has sort of set up their trauma care system a little bit differently. And so in the state of Wisconsin, we designate level 1 and 2 trauma centers through the American College of Surgeons. And level 3 and 4 trauma centers are verified by the state of Wisconsin Department of Health Services. There's no requirement for a hospital to be part of a trauma care system, but we want hospitals to be accredited. And we're going to talk a little bit about why we want hospitals to be part of them. But one thing I really want to emphasize is that one thing that all trauma programs have in common, so it doesn't matter how they're designated, but one of the biggest pieces of having a trauma program at a hospital and being verified as a trauma center is quality. Trauma programs have robust quality improvement programs that really aim to improve outcomes and reduce mortality. So, the trade-off of that is that, you could be getting treated if you are injured at a facility that in theory would have better outcomes because they're constantly looking at ways to improve their care. So, as I said, there are 4 levels of trauma care centers, at least what we recognize here in the state of Wisconsin. And the level 1 center where I work is our highest level center. And so to be a level 1 center, again, you would have to be verified by the American College of Surgeons and capable of providing leadership, training, and total care for every aspect of trauma care. You have to be, affiliated with a medical college. You have to do research. You have to have 24-hour services, access to that OR, to surgery 24 hours a day. And level 1 centers offer services that no other centers can provide. That's sort of part of being part of that level 1 trauma care system. Level 2 hospitals, again, verified by the American College of Surgeons and able to provide initial definitive trauma care regardless of the severity of injury, but differs from a level 1 in that it doesn't necessarily have to have an attached medical college or research facility. Level 3 and 4 hospitals, again, designated in our state by the state of Wisconsin. And a level 3 hospital will provide assessment, resuscitation, and can do some initial stabilization, and then typically do transfer patients out to that higher level of care. A level 4 center, again, provides that initial stabilization and life support, does not necessarily have to have requirements for surgical readiness, but again, can do a great job in doing some initial resuscitation of injured patients and then get them transferred to that higher level of care. Now, again, in the state of Wisconsin, it's not a requirement for a hospital to be classified. A hospital can be unclassified as a trauma center. And as of June 2024, in the state of Wisconsin, 98 of the 133 potential hospitals participating in the system, with 11% of those being American College of Surgeons verified as level 1 or 2, and the remaining 64% of those classified through the state of Wisconsin. So again, 98 of the 133 hospitals do participate in our trauma care system.
So before my retirement from the West Bend Fire Department, we could and would bypass the local hospital to deliver a critically injured patient to Froedtert and the Medical College of Wisconsin in Wauwatosa because it's a level 1 trauma center. That is part of the American College of Surgeons field triage criteria and also in the local protocols for patients meeting that criteria. I know Wisconsin recently published some data about the population and their access to a trauma center within a 30-minute drive time. Ginger, can you talk a little bit more about drive times and trauma center access?
Sure, Kenny. So earlier this year, DHS published the Wisconsin Trauma Drive Time Report, and a couple of key points that caught my eye. In 2023, the Wisconsin trauma system treated over 38,000 traumatic injuries. And what we know is 96% of Wisconsin's population live within 30 minutes of a trauma center. And, one thing to, mention as well is, the facility I work at in Milwaukee, Wisconsin is in the Southeast Regional Trauma Advisory Council, and our region in Southeast Wisconsin has a lot of hospitals, and we have a lot of classified hospitals classified as trauma centers. It's not like that in other parts of the state. And if you ever have a chance to, look up this report, you're not really able to see it on a podcast, but, they have some very enlightening infographics and maps that can really highlight the state of Wisconsin and how rural some of the areas are and how there is truly a limited access to accredited trauma centers throughout the state of Wisconsin. So 96% of Wisconsin's population do live within 30 minutes of a trauma center. But if we were able to get all the hospitals that were eligible to become trauma centers in the state of Wisconsin, that would increase from 96% to 98%. And another way to look at this is if we were to lose all of our level 4 trauma centers, only 55% of rural residents would be within 30 minutes of a trauma center. So why is this important and something for us to talk about? Because it's not a requirement for hospitals to become a trauma center or stay classified as a trauma center. Oftentimes we can see hospitals make that really tough decision to not stay classified. And, that can be a really challenging thing. There's always various reasons why maybe a hospital would make that decision. And a lot of it does have to do with things like the resources available at that hospital, because it does take dedicated resources to maintain that trauma center designation. But, I think one thing that this Wisconsin Trauma Drive Time report really highlighted to me was that it is crucially important that we do support our level 4 trauma centers, especially in those more rural areas, because that could have a significant impact on a community if we were to start losing those centers. We know that injured patients can have better outcomes when they're treated at a trauma center, and time is key. So get that patient to a trauma center in the golden hour to ensure timely treatment and access to resources. And so to do that, we need to make sure that we all advocate to ensure that trauma centers are able to maintain that trauma center designation.
This has been a really great discussion about Trauma Awareness Month and Stop the Bleed Month. Do we have any final thoughts for our listeners?
One thing that comes to mind before we close it out is we know, and we've talked about this in this podcast today, that injuries are a leading cause of death. But one thing that, I've learned throughout the years in being part of trauma care is that the injuries that we're seeing, they're preventable. The majority of things that we see is all preventable. And what it comes down to is choices. And sometimes you don't even realize that a choice you're making to maybe respond to a text message or have some other reaction could have a downstream impact. And so really you have to make a conscious effort every day to make safe choices to keep yourself and those around you safe.
Absolutely. And I would add that I think collaboration is key. All members of the care team and disciplines are needed and necessary for the care of an injured patient when it comes to sharing best practice, guidance, all the way down to injury prevention like we've been discussing today. It really does take a village and includes all individuals in the care continuum, pre-hospital, emergency department, inpatient, OR, rehab, and all of those individuals support those ideas. We're all in this together to improve patient outcomes no matter what the trauma level is in that care facility. We all play a very important role.
And I think too, Kelly, some of the work that we do in our region, all of the hospitals in our region work together. We support each other as trauma care centers. There's nothing proprietary about it. We are all working collaboratively to make sure that we're offering the best practices, prevention, access to prevention materials, access to various education. And I think that's something important to consider when you talk about trauma care systems is, how we as trauma care facilities can interact with each other and then support each other.
We would like to thank Ginger Knapp, Kelli Anderson, and Kim Lombard for the interview about Trauma Awareness Month and Stop the Bleed Month. For more information, you can visit the American Trauma Society website, amtrauma.org. Join us on our next episode when we're back with Magna Media's Rick Jensen. WPLG 715, Fireman Kenny's returning to quarters.
I'm firefighter Regan Roll with the North Shore Fire Department. Magna Media is working with first responders to help keep our communities safe. Magnum Media and the Home Fire Sprinkler Coalition proudly salute our first responders. Here's an important message from West Bend Fire Department Captain Kenny Aslin.
Residential house fires can become deadly in as little as 2 minutes. Homes burn faster today due to modern furnishings and lightweight wood construction. These fires produce smoke that is both toxic and deadly. A fire sprinkler system is the only thing that can stop a fire and deadly smoke from spreading. In less time than it takes firefighters to arrive at your burning home, fire sprinklers control the fire and allow everyone to escape. If you are building a new home, protect your family with home fire sprinklers.
The Home Fire Sprinkler Coalition and Magnum Media are proud to salute our first responders. For more information on Home Fire Sprinkler Week, visit homefiresprinkler.org